Good afternoon, everyone. I'm Dr. Rudrani from HexaHealth. Welcome to today's webinar on tongue cancer cure conducted by HexaHealth. Before we dive into the webinar, let me introduce all our viewers to HexaHealth. HexaHealth is a leading digital platform for seeking medical treatment for various health concerns. We at HexaHealth help you get connected to the right doctor, hospital, pan-India, and provide the best treatment plan post your primary consults. All of this at the best cost possible with a hassle-free process. Having said that, today we'll be busting all your myths and simultaneously learn more about the most widely spread disease of the mouth, that is tongue cancer, and how to treat it. We have with us Dr. Shilpi Sharma, specialized in head and neck oncologist and currently practicing at Narayana Health, Gurgaon. She is graduated from the first inaugural batch of MPH in head and neck oncology at India's leading Institute for Oncology, Tata Memorial Hospital, Mumbai. She has previous experience in India's flagship National Cancer Institute, Nagpur. She has a combined experience of 19 years. Her specialty interests of Dr. Shilpi are oral cancer, parotid cancer, thyroid cancer, reconstructive surgeries for head and neck, mesothelioma, etc. She is also an active member of the Asia Pacific Society of Thyroid Surgery, the Foundation for Head and Neck Oncology India, and the Indian Thyroid Society. Some rules of the webinar would be these. Feel free to raise your queries using the chat feature. Type your questions and we assure you that your doubts will be answered. We shall be conducting a poll during the webinar to understand whether the points discussed are of relevance to you. Respond to the poll questions to help us serve you better. Don't worry if you have joined late or you leave early. We will be sharing the webinar summary in a day's time to all the participants. If any question is missed, you can reach out to us in this number. Going ahead, coming to the disease itself, oral cancer, which is including mouth, thyroid, tongue cancer, are the most common type of cancers in India today. These cancers spread fast, are generally not painful, and hence go undiscovered till the later stages. They carry a big risk of recurrence if not attended properly the first time. Hence, without any further ado, I would like to ask the first question to Dr. Shilpi ma'am. And the first question would be, how fast does the tongue cancer grow?
Yeah. So, hi, first of all, good morning, everyone. And so to answer this question, I would say that tongue cancer is relatively a fast growing cancer. There are certain cancers in the body like thyroid cancer, which grow at a, very slow pace, but tongue cancer is not one of them. So it is recommended that if you notice any abnormal thing in the tongue, like any ulcer or anything, any suspicious lesion, please do not delay it, because sometimes what happens, we keep thinking that it's a small thing and we ignore it, and it keeps growing at a very fast pace, and many times patients come to us when it's already quite late and it has kind of involved more than half of the tongue. That's very common phenomena to happen, which we see on a routine basis when we see these tongue cancer patients.
Okay, thank you so much, ma'am. The next question would be, what are the warning signs that one should look out for if they feel that they might be having any cancer?
Yeah. So warning signs is very important to know. For it is very important to know beforehand the warning signs of any cancer. For tongue cancer specifically, I would say that any ulcer. So any ulcer in the tongue which is not going on its own, despite or without doing any treatment. Normally, the common ulcers which we routinely see in day-to-day practice, they heal on its own in a 1 week, 2 weeks time. But suppose if you have an ulcer which is not changing, it may not cause any problem, it is just there, please do not ignore it. And every ulcer which is not going for about almost 3 to 4 weeks, it warrants biopsy. So it is recommended that you don't see anyone, any physician or any doctor, you should consult a oncologist, rather a head and neck oncologist. Then the second most common lesion which we see is that it may not be ulcer, but something abnormal area, any roughness, any hardness in the tongue, or any abnormality which is more, worrisome when it bleeds on touch. So that is also one thing which should never be ignored. Then many times patients, they give history of having a white patch or red patch instead of an ulcer. Even that is also, very, very notorious thing, because it can very progressively and in a very short period of time, it can convert into cancer. Besides that, when the cancer arises in the posterior part of the tongue, there might not be any ulcer, there may be nothing. Patients may not feel anything in the beginning. The very subtle sign which may happen is that there may be some difficulty in swallowing, something foreign body sensation, as something stucking inside the mouth while eating. That also warrants some kind of investigations. Then sometimes there is just a change in voice, so alteration. So voice may be slightly altered. There may be some difficulty in speaking few words. So even that could be, because of the cancers in the tongue. So these are the main warning signs which should not be ignored. Another thing, one more thing which happen in tongue cancer is that sometimes there's just difficulty in movement of the tongue. So patients are not able to protrude the tongue fully. So that is also one of the sign of the tongue cancer. Important thing to remember is that, especially it is true for every cancer, that in the beginning there is no pain. So many times we keep ignoring, thinking it's just an ulcer, it's just an abnormality, just a white patch, it is not causing any pain, then it should not be a worrisome thing. But it is not true. In fact, in the early stages, there is no pain. When the pain happens, it comes, very late when it has already gone deep. So these are important points to be remembered.
Okay. Thank you so much, ma'am. That was very informative. Next, the question that we have is, how is it treated? How is a oral cancer or tongue cancer treated?
Yeah. So if we talk about treatment in general, not just tongue or oral cancer, in general throughout the body, if we talk about, there are three main modalities of the treatment. One is surgery, second is radiotherapy, and third is chemotherapy. And it's what I call similar branches like immunotherapy, and we have targeted therapy, and we have conventional chemotherapy. So all these together broadly are termed as chemotherapy. When we if we talk about tongue cancer, now we have to, it depends on many factors, that whether we should do surgery, whether we should do radiotherapy, or the combination of chemotherapy. First, we have to decide, as an oncologist, whenever the patient comes to us, we have to decide that where the cancer is originating, which is the epicenter. So tongue, for the purpose of treatment of cancer, we divide into two. Like one is the anterior tongue and then the posterior tongue. So in general, anterior tongue are treated by surgery, but yes, there are one or two things sometimes when even we can give brachytherapy when it is very small, and when the patient is not willing for surgery, or for some reason if the surgery cannot be done, then we can do brachytherapy. But in general, for anterior tongue, surgery is the main modality. When it is early diseases like stage 1, stage 2, surgery alone is sufficient. But when it crosses stage 3 or stage 4, it has gone to the neck, then we use combined modality treatment. That means surgery along with radiation therapy. And sometimes if it is aggressive, very aggressive, then we also add chemotherapy. So that is for anterior tongue. Now for the posterior tongue, because it is posterior, if we do surgery, there are functional morbidities. I mean, there will be great problem with speech and all. So we reserve the surgery as a salvage option. And for posterior tongue, we start with either radiation therapy and chemotherapy, or radiation therapy alone, depending upon the stage. But yes, there are some instances, if you have very small posterior tongue, now we have robotic surgery, even that can be offered. So it is kind of in one go, we cannot say that, okay, tongue are treated with surgery, they are treated with chemotherapy or radiation therapy. It's a multi-modality treatment. We do, usually we kind of decide in a multidisciplinary clinic. Only one thing I want to emphasize, because as oncologists, we keep seeing cases, sometimes that chemotherapy is very widely used. Chemotherapy alone for treatment of tongue cancers, which is actually not very much evidence-based. Chemotherapy alone for tongue cancer is to be given in very select situation. It has been proven by international studies and trials. It has been proven that if a tongue cancer, anterior tongue I'm talking about, is amenable for surgery, then that is the best modality. Because even if you add chemotherapy, then it does not result in any benefit. And of course, there are problems of chemotherapy, there are side effects and all, which can be easily avoided. So chemotherapy alone we give in situations where upfront we cannot do surgery, then we offer chemotherapy, it reduces, then we do surgery. But this is for anterior tongue. Posterior tongue, like I told you, the main modality is non-surgical to begin with.
Thank you so much, ma'am. Now, before we move to the next question, we have a short poll for the viewers here. I would request the viewers to kindly give your results to the poll and answer those questions. What are the important factors for you to decide for your treatment? And the option that we had was doctor, trust, experience, and reviews. Second was hospital, infrastructure, emergency unit, ICU units. Third was cost of treatment. Next was empanelment with your insurance. The next was easy access. The next was post-operative care and follow-up. And the last was others. So most of the people have voted for doctor, trust, experience, and reviews. The next, we have voted for hospital, infrastructure, emergency, and post-operative care and follow-up. The rest of the answers like empanelment and easy access have similar ratings. So, ma'am, I think what the viewers here have majorly emphasized on is the doctor, the trust and the experience that they have at the hospital and the treatment they're undergoing, and the hospital infrastructure. Majorly, they are also looking for post-operative care. So, do you think that we can share some valuable input on this, as well as how much post-operative care and what is the need for a post-operative care and what is the need for a follow-up in situations like an oral cancer or a tongue cancer?
Yeah, so post-operative care is very, very important thing. So post-operative care means when the patient is already hospitalized and surgery has been done, and then we are doing, taking care. So initially, it also depends on what kind of surgery has been done, what was the extent of the surgery. But initially, usually for tongue cancers, we keep the patient in ICU for at least a day. Sometimes we may have to keep for 2 days also. And there are other factors which determine it. So we take care of everything, all the vitals, and how if the plastic surgery has been done, then how the flap is behaving and everything. So yes, it is a very important thing in the management of any patient. Yes, patient is hospitalized and it's doctors and nurses and hospital's responsibility to take care of the patient. But to some extent, it also depends upon the relatives and how they should also be actively participate. I always encourage my patients attendants to see what we are doing, to grab things. Sometimes when we are discharging the patient, there are certain things that patient also has to continue at home. For example, we are giving rice tube feeding, so what we are doing here, but then eventually they have to go home, and for 1 or 2 days minimum at least they may have to continue. Sometimes we just remove the rice tube while patient is hospitalized also, but sometimes it is it's ongoing process kind of things. So attendant also should actively participate and learn, and because whenever there is a problem they can ask, and that is very important thing to do. And another thing is that they should keep the patient also motivated. And that is why we, one reason we restrict the entry of too many relatives and all, because sometimes they may, make some discouraging remark, which really disturbs the psyche of a patient and the attendants.
Yes, ma'am. No, ma'am. I definitely agree with you on that. Moving forward, the next question will be, does tongue cancer recur ever? And if it does, what should we look out for and what should we do next?
Yeah, so very important question. So not just true for tongue cancer, any cancer can recur. That is the problem with the cancer, that we cannot predict. That we can predict to some extent that what we are dealing with, whether there are certain cancers which have certain favorable features. There are features, for example, what was the grade of the tumor, whether it has gone to the lymph nodes or no, whether it was involving surrounding structures or no. So based on that, we basically decide the stage. And then in general, if we say the early cancers, they have good prognosis. That means the chances of recurrence in those cancers are less. And when we are dealing with advanced stage cancers, the chances of coming back of it in future are high. Now, having said that, yes, it's general thumb rule that early cancers, they have good prognosis, but we cannot say at present that if we are dealing with stage 1 cancer, it will never recur. certain percentage of patients, even if it is stage 1, even if it is very good variety, they can experience recurrence in future. In general, if in simple terms, if I say, suppose we see 100 patients of tongue cancers, so then for early stage, like stage 1, the chances of recurrence are about 5 to 10%. That means out of 100 patients treated, 5 or 10 patients may come with a recurrence, and the figure gradually increases as the stages increase to 2, 3, and 4. Another thing is how to tackle with it. It depends upon what is the duration, when the cancer has recurred, what is the stage at the time of recurrence, what treatment has been offered before. So, for example, if it was a stage 1 cancer, it has recurred now, which is still operable. We still go ahead and do surgery, and this time we prefer to give radiation even if it is small cancers, because early stage cancer, it has been treated, probably the radiation therapy was not given. So we try to be more aggressive whenever we are dealing with recurrent disease. Sometimes it is not possible to do surgery, if the patient has received radiation therapy, it is not possible to give radiotherapy alone. Then we take the help of immunotherapy and chemotherapy. We have now immunotherapy, thankfully, with us. So immunotherapy is kind of a chemotherapy, but the conventional side effects of chemotherapies are less. And it is, for at least for tongue cancer, the main role of immunotherapy is in this situation only. When the patient recurs and then we are not in position to offer surgery or radiation therapy, then immunotherapy comes into picture. And otherwise, if it can be second time treated or cured, then again they have to do follow up at certain interval like earlier. In general, we tend to be a bit aggressive in treatment with recurrence cancer if possible.
Okay. Noted, ma'am. That was very eventful. Now we have some questions from the patients who have joined in. Some of the questions that have come up, and one of them was, if lymph node is removed, can those be reconstructed, is asked by someone. And the next would be, what are oropharyngeal cancers?
Yeah, so first let's take up the first question. So lymph node is not something that it should be reconstructed. So lymph node is something which is already there in the body. It is an organ which kind of participates in the lymphatics, it stores the lymph cells and lymphatics and all. So they help in immunity, and whenever there is an infection, the cells are, they are enlarged, and in case of cancer, the cancer cells can deposit. But there is nothing that we can do to reconstruct. It's just an organ which has to be removed if it is involved by the disease. But there is no need to reconstruct it as such. Yes, there are some issues like lymphedema may happen because if it is not properly, it's more commonly seen in breast cancer cases. But there are then other therapies and other modes to reduce the lymphedema. In general, we can't do that, that one side lymph nodes are removed, so then it has to be reconstructed. The body takes care of it. If you have done one side of neck dissection, the other side of lymph nodes, they take up the role, and then they start functioning. If we have removed bilateral, very commonly we do bilateral neck dissection also. We have not seen as such any problem in terms of infection or something. Then other lymph nodes, they take up the action. So this was regarding the first question. Now what are the oropharyngeal cancers?
Oropharyngeal cancers.
Yeah. So basically, oropharynx is, so there are different sides. So we are talking about oral cavity or mouth over here, where when I mentioned that anterior tongue. So like I told you, tongue has two parts. One is anterior and the posterior. The posterior 1/3 is a part of oropharyngeal. So these are the anatomical division which we have divided. So if you look at base of tongue, tonsil, and then lateral pharyngeal wall, where the tonsils sit, that area, anterior pillar, posterior pillar, soft palate, these are the part of oropharynx. So if the disease is arising any of this area, that is labeled as oropharyngeal cancer. So if you have a anterior tongue cancer, that is tongue cancer, oral cavity cancer. If you have cancer in the posterior part of the tongue, now how do we decide anterior posterior? We take the circumvallate papilla as a demarcation line. So if you see, if you just look at your tongue in the mirror, you will see that there are small spots. Many times patients come to us that they fear that this is something abnormal. So that is the papilla. Now, whatever anterior to this is anterior tongue, whatever posterior to this is posterior tongue, which is a part of oropharyngeal cancer. If he means by asking oral oropharyngeal, then probably if the anterior tongue lesion is going on to the posterior tongue, you may label it as a oral oropharyngeal or vis-a-vis. Many times we can't, whole of the tongue is involved, then we have to decide whether it was oral to begin with or oropharyngeal to begin with.
Okay, ma'am. Ma'am, one more question that I have for you is, what is the major cause, or if you can see, what are the major risk factors involved that can determine that whether this treatment or whether this cancer that has happened to the patient, is it going to first of all, is it the treatment line that I'll follow along with the cause of the cancer? What is the severity of that cancer? And if the severity of the cancer after treatment is going to get reduced, what am I supposed to expect as a patient after the treatment?
No. So come again, what is exactly your question? That the cancer has been treated. Now you're asking what is the probability whether it is going to come back again? Is that your question?
No. So I was asking, so suppose the severity of the disease, the severity of the cancer that is there in the mouth is because of some cause. So firstly, my question is, what are the major causes that one should know why it was going to happen to me? And secondly, if that treatment has been done, if I've undergone a surgery or a chemotherapy, after the treatment is complete, what as a patient after the treatment should I expect, or what should I need to follow as guidelines so that my treatment is successful in the longer run?
Okay, so one thing is that the causes, and the second thing is how should one as the patient should do follow. So yes, one thing is the main cause for the tongue cancer is tobacco consumption. Alcohol is the second number one. Supari is also another cause. Then gutka again contains combination of supari and tobacco and all, so that also comes under this category. Then there is one more cause, HPV infection. Now HPV infection is still not a problem in India. It is more of the problem in the Western world where the tobacco is not the major cause. In India, still the tobacco, alcohol, mainly the tobacco, chewed tobacco to be more precise, is the most common cause for the tongue cancer. Then other thing is, one thing which is surprisingly is also seen nowadays is, for example, those patients who chew tobacco, there is something known as field cancerization. So what is that? That yes, we have experienced cancer in one part of the tongue, but surrounding area which is normal at present can convert into cancer or can show the cancer, second cancer later on. And we do take care as an oncologist. Whenever we see our patient in follow-up, we always look at the surrounding areas also. Then third thing is that you should do regular follow-up with your oncologist. There should not be, delayed. And initially, in general, the frequency is earlier, like 3 months to 4 months we see. And then as the time progresses, like after 2 years, we increase the duration to 6 months to 7 months. And then once the 5 years are over, we usually see once in a year. So I can actually say that someone has written both sides of my neck, the lymph nodes have been removed. Is it going to cause any problem in future? So like I already mentioned that many times when we do bilateral neck dissection, many of our patients, because tongue cancer, many a times we see the patients in advanced stage where it has crossed the midline. So in those situations, we routinely do bilateral neck dissection. That means we remove the lymph nodes from both sides of the neck. As such, it does not cause any problem. Only thing is, something is said that there may be more chance of lymphedema after radiation. That means there may be some, fibrosis or swelling in the neck, but we don't know whether it is really related to the neck dissection or it is because of the radiation therapy. So in general, there is not a major problem because of this.
Ma'am, Roop Narayan Singh has a question for you. I'll just ask him what's the question. Please, sir, ask your question.
Hello.
Sir, if you're not able to connect to an audio, please put your question on the chat.
Sir, you need to unmute yourself before speaking. Or you can write in the chat box or question answers, whatever. Or otherwise, if we are not able to do any of these things, then we can do that later also. You can, the number was displayed. So maybe you can just type the question there, and we can later on. Okay, so someone has asked that 2 days back, I was feeling a lump just below the chin. Okay, so if you're feeling, or if you have noticed something abnormal, you should at least consult someone, because it is a very vague thing. Sometimes the lymph nodes can be enlarged. Just, there may be some subclinical infection, or there may be some viral infection. So because of that also, you can have a sensation of lump below the chin. But it could be something else also. It could be a lymph nodes, or it could be a parotid gland. So it's better that if you are feeling something, you should see, preferable at a head neck surgeon. You can go and consult and clear your doubt.
Thank you so much, ma'am. I think we have been able to solve the queries related to the tongue cancer treatment here. We aim to positively impact your health outcomes. Hence, we shall share the event summary with answers to all relevant questions in a day's time. If you wish to consult Dr. Shilpi Sharma in the future, or speak to our team, that is my team, for any assistance, you can call us on the number mentioned, and you can also share your reports on the WhatsApp number mentioned. Thank you so much for joining us. Thank you so much, ma'am, for this informative session. It was very nice to have this education session here. It was really very helpful. Thank you so much, ma'am.
It was my pleasure.